ask these same kind of questions, and I hate to say, no, you'll never need to know this part of anatomy, or you'll never need to know that part of anatomy. Invariably, something will happen. They'll hear something in a clinical medicine class where they'll say, well, you said we never needed to know that, and then I get in trouble. So anyway, I'm not trying to be coy about this. I guess maybe I am a little bit, or not trying to be tricky. Certainly not trying. I'm always trying not to be tricky. I just try to be straightforward. But anyway, let's just go on. If you have any questions where you are confused, just please feel free to shout out. So anyway, let's go back to I think we were talking about the innervation, all the nerves that are involved in the oral cavity, and we got through what moves the lips, what closes the mouth. Mostly talked about what's closing the mouth there. That was, and yes, it's a trigeminal nerve, and then there are these three divisions. And it was, somebody asked about, would I want you to say trigeminal nerve if I asked what nerve innervates the muscles that close the mouth, or would I want you to say mandibular division? So the most correct answer, the most specific answer is the mandibular division, or V3. So usually I would, I guess that would be the best answer. I guess, again, always try to be as specific as possible. So if both answers were choices, I would want to pick the most specific one. So, and then we talked about what innervates the muscles of the tongue, and that was 12, and you remembered that from neuro, I think. What nerve supplies general somatic sensation to the inside surface of the cheeks and to the tongue? Sorry? It is? Yeah. Yes, it is. So we have those like three dermatomes that we refer to on the face as V1, V2, V3. They also refer to, like the nasal cavity, the oral cavity. So V2 and V3 are involved in the oral cavity, and that's getting a little too specific, but the tongue and the mucosal membrane lining the inside of the cheeks is the trigeminal nerve. So, and somatic sensation, that's just general sensation like heat and cold, touch, that kind of thing. Then we have sensory nerves that provide special sensory, as opposed to just somatic sensation, special sensory sensation. That would be taste. So you've probably talked about what cranial nerves are involved in taste? No? So we'll talk about that now. So the ones, remember we divided the tongue up into an anterior 2/3 and a posterior 1/3. So the anterior 2/3 of the tongue, actually for the general sensation, the anterior 2/3 is innervated by the trigeminal nerve, as we said over here. The posterior 1/3 is the general sensation is from the glossopharyngeal nerve, cranial nerve 9, and there's another slide that will point this out more clearly. I think I keep going backwards here. Yeah, so we'll get to that. So taste has its own special nerve fibers. So those taste buds that we talked about before, they are on the anterior 2/3 of the tongue. They are actually innervated by branches of the facial nerve, cranial nerve 7. So on the posterior third of the tongue, there are some taste buds back there also that are innervated by cranial nerve 9 also. So the posterior third of the tongue, general sensation and taste is from 9. But for the anterior 2/3 of the tongue, the general sensation is we'll just say trigeminal, and the taste is from the cranial nerve 7. Cranial nerve 10 has a little bit to do with taste, but it's like taste buds on the epiglottis and places like that, so. Okay, so, and then, so let's, you may have talked about the pathway of the branches, the divisions of the trigeminal nerve. So we have, this is going to illustrate, we're looking through the skull here into the cranial cavity, and that's the trigeminal ganglion. That's probably familiar to you, right? No? So, that's okay. I guess I was thinking that Dr. Olgan had maybe talked about some of this stuff already, but that's okay. That's all right. No? Briefly? Okay, so you know the cranial nerves and their numbers. Yeah, okay, so you haven't talked about the pathway through there. You haven't talked about the, okay, so cranial nerve 5, trigeminal nerve, that part you're aware of. You know it's attached to the brainstem probably, right? But then it has this big sensory ganglion. When I say dorsal root ganglion, that probably means something to you. Yeah, dorsal root ganglion. So the trigeminal ganglion, which we're seeing right here inside the cranial cavity, right beside the brainstem, there'd be one on the right side, one on the left. That's analogous to a dorsal root ganglion. So there are sensory neurons in there, and then from that ganglion there are these 3 big nerves, the divisions of the trigeminal nerve, the 3 divisions. One is the ophthalmic division, probably V1. That goes into the orbit. We're not going to talk any more about that. One is V2, or the maxillary nerve, and one is V3, the mandibular nerve. Let's look at this mandibular nerve first. So this is V3. We don't really see it going through a specific hole here, but it leaves the skull through a specific hole, and it gets into the region we call the infratemporal fossa. Remember when we did that dissection on the slide where we took away the ramus of the mandible and went into that space just medial? We saw the medial pterygoid and the lateral pterygoid in there. When the mandibular division of this nerve comes out of the cranial cavity, it ends up right in the infratemporal fossa. And then it gives off motor branches to lateral pterygoid, medial pterygoid, masseter, and temporalis muscle. So the V3 does carry motor fibers in addition to sensory fibers. And then another thing that the mandibular division does, and it's kind of shown here, here is the nerve. We see a lot of branches there. They're giving off the motor branches to the muscles. But one of the major branches actually enters the mandibular foramen. Now that was the foramen on the medial surface of the ramus of the mandible. So the nerve goes in there, into that foramen, and that leads into a mandibular canal. This canal goes right through the bone, the mandible. So it goes down through the ramus onto the body. So what do you think that nerve is going to do? Here it is, it's in the bone here. Here we've chipped away the anterior surface of the cortical bone. We've gone into the region of the spongy bone, but see what it's doing? It's giving branches to the mandibular teeth. These are the sensory nerves that supply the mandibular teeth. So I have a slide in the lab talking about what a dentist does. If a dentist is going to work on a tooth in your mandible, what they will do is open your mouth and they'll stick a needle way back there and inject the anesthetic into the region into the mucosa that's lining the medial surface of the ramus of the mandible. That mandibular nerve, or inferior alveolar nerve is actually the name of it, is going to be right in that area, and it will be anesthetized, and one half of the mandibular teeth, all the mandibular teeth on that side are going to be anesthetized. Okay, so we'll look at that. And do I have inferior alveolar? I might have not. Yeah, so we're just gonna talk about B3. We don't need to talk about the specific branches. So it's very easy for a dentist to anesthetize the lower teeth. They can do one injection, either on the right or on the left, depending which side they want to work on, and all the teeth on that side will go numb. Look at the maxillary division of the trigeminal nerve now. It comes into it, it does not go directly into the infratemporal fossa. I'm not even going to say the name of where it goes, but it's going to get into the maxillary bone and divide up into all these branches that we see here. And you can see these are going to the teeth. They're going to have some other roles also, but this is where the teeth of the maxillary alveolar process get their innervation. So when a dentist is going to work on a maxillary tooth, they have to give injections around that surround each tooth that they want to work on. It's harder to anesthetize those teeth than it is the ones that are in the mandible. Okay. All right, so this is just showing the course then of a couple of the other nerves. One here is the hypoglossal nerve. This is the hypoglossal nerve, so you know that's cranial nerve 12. You know it's coming off of the brain stem. I think Dr. Oldham probably didn't talk about how it leaves the cranial cavity. Hypoglossal canal, she did talk to you about that. Or did you just know that? Okay, so you've put it together. You didn't talk about nerves, I guess, in bones, but so that's good. So this is tying the whole story together now. So one of the holes is called the hypoglossal canal, and the hypoglossal nerve, and only that nerve, goes through that opening, and that gets it down into the region of the pharynx. And here it comes. It's just come out of the hypoglossal canal, and now it's going down into this region here where it's going to innervate the muscles of the tongue. I don't think I mentioned this before. I think some of the text will talk about this, though, that I have on a slide. The tongue is made up of skeletal muscles, but those muscles are described as intrinsic muscles and extrinsic muscles. So do those terms have some meaning to you? You can probably guess what that means. I just think back to the back. When you talked about the back muscles, you had extrinsic muscles of the back and intrinsic muscles of the back. Same thing with the tongue. So intrinsic muscles of the tongue start in the tongue and end in the tongue, and they're some of the ones that can help us, roll it and change its shape. Extrinsic muscles are going to have one attachment inside the tongue and another attachment outside the tongue. So some of those extrinsic muscles we see here, you see this like a sheet of muscle right here. It's attached to the hyoid bone right here, but then it extends from the hyoid bone up into the tongue. That's called the hyoglossus muscle, innervated by cranial nerve 12. There is another big muscle right here attached to, I mentioned this before, the posterior surface of the mandible. There's a little tubercle there, genioid tubercle. This is the genioglossus muscle, innervated by 12. This muscle right here, you can't really see where it's, well, you kind of can see where it's coming from, but you'd never guess this from the picture. On the base of the skull, there's the styloid process, which you're familiar with. There's several muscles attached to that little needle-like process. One of them is called the styloglossus, and here it is right here. You see the styloid process right there? It's not labeled, you would never know that maybe, but that is the styloid process. And here comes the styloglossus muscle, innervated by 12. If the styloglossus muscle protrudes or contracts and shortens, you can see how that's going to lift the tongue. So when you swallow, that's going to be very involved in lifting the tongue and helping the tongue push a bolus of food posteriorly. The hyoglossus is going to pull the tongue inferiorly. which muscle do you think would contract to allow you to protrude your tongue, to stick your tongue out, get it past the lips? That would be this guy right here, the genioglossus muscle. So that's kind of how those, and then the hyoglossus and the styloglossus both working together could retract the tongue and get it back into the mouth. Okay, any questions there? The next thing, this is just kind of another, now this summarizes the whole thing we've been talking about in terms of innervation. So we see that on the anatomical right side here, we're looking at the dorsum of the tongue. This is indicating the motor innervation to the tongue. It's pretty simple. It's just the hypoglossal nerve. There is one exception to that. I almost hate to say this because it's like a detail, so one extrinsic muscle that it's called the palatoglossal muscle, and we talked about the palatoglossal arch. This muscle is what produces that arch. That muscle extends from the palate to the tongue to make that palatoglossal arch. That's a palatoglossal muscle. Now we say that cranial nerve 12 innervates all the skeletal muscles of the tongue. Cranial nerve 10 innervates all the skeletal muscles of the palate. So now we have this conundrum. We have a muscle that's starting in the palate and extending to the tongue. It turns out that that muscle is innervated by cranial nerve 10 rather than 12. So, I mean, this is really in the weeds now, so this is not the most critical thing in the world. So mostly when we think of innervation of the tongue muscles, we're thinking of the hypoglossal nerve. Now on this other side where we have a lot more activity, it looks like, we're looking at the sensory innervation. And we have general sensation, and on the anterior 2/3 of the tongue, we decided that the general sensation was going to be provided by the third division of the trigeminal nerve, the mandibular division. It's actually a branch called the lingual nerve, but we'll just go with trigeminal nerve, V3, or mandibular division. That's the blue area right here. So this is like if you burn your tongue on pizza cheese. This is the nerve that's telling you, okay? If on the posterior 1/3 of the tongue, you have general sensation also, but it's provided by the glossopharyngeal nerve, cranial nerve 9. So then the other thing we have going on here is special sensation, that's taste. So the taste buds in the anterior 2/3 of the tongue are going to be supplied by cranial nerve 7, you see that right here. And this this chorda tympani is actually the branch of the facial nerve. I'm not going to ask you about the chorda tympani. I just want you to know cranial nerve 7. Yeah, so the way this says lingual nerve, cranial nerve B3, that's the third division of the trigeminal, that's the general sensory. And then the chorda tympani, which is a branch of cranial nerve 7, is the special sensory. But if we remember B3 of the trigeminal nerve and facial nerve, that would be good. So that gets a little bit confusing. So anatomy, we think of the structures, the innervation, the blood supply. So let's just think about the blood supply a little bit to the mouth. I think this will largely be, if not review, you've heard the main part of this story. So we're talking about a region of the head. So we have on both the right and left side, we have a common carotid artery coming. These are the great vessels. You've done cardiovascular, right? Yeah. So you know about common carotids. They divide into internal and external carotid. The internal carotid is basically on its way to the brain, so it's not going to be giving off branches in the neck and to the face. The external carotid its job is to supply parts of the neck and the face, including the oral cavity. So the branches that are important as far as the oral cavity goes would be lingual. So here's the external carotid. It gives off like 8 different branches that are usually discussed in the anatomy lab, but one of them is the lingual artery, and as you can guess, that's going to go mostly to the tongue. Here it is, it's going underneath or medial to the body of the mandible, and then it's going to go directly into those muscles of the tongue. The other branch here is the facial artery. You see that? You can even get a pulse of that artery running right on the body of the mandible back towards the ankle. So you feel it thumping away there. So it's going to go up across the face near the commissures, the labial commissures on either side. You'll probably never hear anybody use that word again, but so then it gives off an inferior and a superior labial artery, and then continues up here right along the side of the nose to the eye. I think that's called the angular artery, but we don't need to know that. So facial artery, lingual artery, then there's another branch. We call this one of the terminal branches of the external carotid artery. So the external carotid artery is going to give off all these branches, and then it's going to end by dividing into 2 arteries. One's called the superficial temporal, which goes up here around the temporal fossa. And for people that don't have, if you have somebody that has a real short haircut and they're hot, playing sports or something, you see that artery pumping right here. That's the superficial temporal artery. The other terminal branch is called the maxillary artery, and it doesn't go up this way, it goes medially this way. So it takes its origin right here behind the mandible, behind the ramus of the mandible, and then it goes medially. And it's going to give off branches in that region I referred to as the infratemporal fossa. So again, we're looking into the infratemporal fossa right here, and we see we've taken part of the ramus of the mandible away. And there's one branch here called the inferior alveolar branch of the maxillary artery that's supplying the teeth. See the branches, they go into the mental foramen, into the mental canal, and then they give branches that enter the pulp cavity of each of the teeth. That maxillary artery continues, it's actually on its way kind of to the nasal cavity, but it gives off branches that then also go, they form superior alveolar branches that go through the maxillary bone and get into the maxillary teeth, the same way the inferior alveolar goes into the mandibular teeth. So I think, again, just understanding maxillary artery, facial artery, lingual artery, and from those names, kind of understanding what's going on, understand the maxillary artery is giving some branches to the teeth. Is that good or confusing or? Okay. So this slide is showing like parts of the maxillary artery. We're not going to worry about that. That's okay. So not too much more. I think we've already touched on this. You've already talked about the pharynx in terms of respiratory tract. Again, it's these arches are very important just to get oriented here between the oral cavity and the oral pharynx. But you already know about the oral pharynx and nasal pharynx shared by the respiratory system and digestive system. Chewing and swallowing, I think I mentioned that along the way. So this can get overly technical from my point of view. There are physicians that just deal with swallowing. Swallowing is a really complicated process when you start adding all the neurology to it, and there are lots of issues associated with swallowing, but we're not going to go into all that. But the one thing that I do, that I think you probably already know that. This is kind of illustrative right here. Here's a little bolus of food, kind of very tiny. So you can see how the tongue is being elevated. So when we swallow, all this stuff in our neck is elevated up and our tongue is elevated. So if you just take a moment, I can't do this, I just talk too much, but if you swallow, you feel you do feel your tongue elevating and going posterior. And what it's doing then is just pushing that little bolus of food against the soft palate. That soft palate there are muscles that are tensing that, but then the food and tongue together are pushing it against the posterior wall of the oropharynx, blocking off the passageway into the nasopharynx, and then pushing that bolus of food down over the epiglottis and into the esophagus. And I think that's, so here I just asked, what muscles protrude the tongue? So we talked about that. That's mostly the genioglossus, which shortens. It's going to pull the tongue anteriorly and move the apex past the lips. Which muscles retract the tongue? The styloglossus attached to the styloid process, the hyoglossus attached to the hyoid bone. The hyoglossus too is once you swallow, when you elevate your tongue, of course it's the hyoglossus then that can pull the tongue back down. So that's, now I think you can think about these in terms of those muscles that we were mentioning. You probably looked at a picture like this. Have you? I think this was probably Dr. Dunn. So I just added this picture just to give you some, like an overview. So, and this is a dissection we do in lab that's complicated, but it's pretty, it'll end up looking just like this. So this is where a coronal section has been made through the head, and it's opened up the space between the vertebral column and the viscera of the neck, and the face has been pushed forward away from the vertebral column. So now what we're seeing is the base of the skull here with the pharynx, the nasal pharynx attached. And here is the median raphe between the muscle, the pharyngeal constrictor muscles, and then here they are continuous with the esophagus. So what's been done here in this dissection is we've taken a scalpel and opened up the pharynx right along the midline here, and then spread it open like this. And now we're looking into the posterior aspect of the nasal cavity here. This is the nasal cavity, and here is the passageway between the oropharynx and the oral cavity. So here's the root of the tongue. Right here we see some of those lymphatic nodules on there. You see the uvula here, and of course this is the epiglottis. And then here is the laryngeal pharynx here, in a famous area called the piriform recess, where little children can manage to get peanuts or something stuck there. And then the laryngeal pharynx is going to be continuous with the esophagus, but that gets us into tubular GI, which will be tomorrow's topic. And then this is just some text that, again, talks a little bit about the swallowing. I think we've gone over all that. So let's just go through some of the lab stuff.